Differentiated service delivery for adolescents. Adolescence is a time of vibrancy, exploration, and self-discovery. It is also a time of rapid physical, psychological, and emotional development that affects how adolescents think about themselves and their world, which is often changing. Adolescents are diverse and come from different walks of life. Their needs are different from children and adults and are continually evolving. They have dreams and hopes for the future and are moving towards independence.
Hi, I'm Jane. I'm 15. I live with my parents in South Africa. My mom can be super strict. She says that I have to do my chores and focus on my schoolwork. I mostly want to hang out with my friends. I'm actually good at school and would love to be a teacher one day. The other day, I told my best friend about this boy I like. Ooh, there's no way I could tell my mom.
Changes during adolescence can greatly influence the way adolescents view their health and interact with related services, not just affecting their health in adolescence, but throughout their lives. Adolescents living with HIV face extra challenges. Accessing and remaining engaged in care, taking meds every day, managing disclosure, coping with stigma, and thinking about the future can be a lot to handle, especially without support.
I was born with HIV and have been taking HIV treatment for 10 years. I only found out about my HIV status 3 years ago. The health worker told me. My mother was afraid. I felt angry and sad at the same time. I'm okay now. Outside my family, I've only told my best friend about my status. I still don't know if I should tell this guy I like. He could reject me. Now I know about HIV, I understand the importance of taking my meds every day. My ARVs keep me healthy, and I plan on living for a long time. I still have so many questions, but the clinic is often so busy and there's no time to ask. I go to all of my appointments. Ish, they don't make it easy. My clinic is far, it costs too much for transport. I'd rather spend that money on airtime. Because the lines are so long, I can be at the clinic all day and then miss out on important schoolwork. Don't even get me started on the attitudes of some of the health workers.
All adolescents living with HIV need support, and HIV services need to provide it according to their diverse and changing needs. As countries move to differentiated service delivery, continual assessment of an adolescent's needs, including psychosocial, is essential to help establish how they can best be supported. Support should be provided in an empowering way that encourages their emerging independence and self-management. Adolescents should be offered options for how they want to receive support and given clear information on how to access all available services when needed. Service delivery platforms beyond the health facility, such as community and peer interventions, are crucial to facilitate early identification of challenges, rapid proactive follow-up, and to activate additional support.
My nurse mentioned that there is a support group with other young people like me. I went to check it out. I could sit and talk to others. We share our problems and we get loads of information. One girl told us her experience of telling others about her HIV. It was super helpful. The nurse checks in to make sure I'm doing okay. We don't just talk about ART. She asks questions about me, my life, my family, my friends, what's worrying me, what makes me happy. I even get to ask questions about relationships and sex. I get my ART there, and I can still go back to the clinic if I ever feel ill. They also said that one of the support group workers can go with me to the clinic when I need family planning services.
Adolescents lead full and active lives that are not orientated to attending health services. This is also true for adolescents living with HIV. HIV does not define who they are, but it does bring added complexities. Meeting adolescents where they are in all their diversity means breaking down engagement barriers and taking services to them. It means giving them choices and the possibility to make decisions about their healthcare. It's recognizing that adolescents change rapidly, as do their needs, and services need to adapt accordingly to ensure their well-being. Differentiated service delivery is an opportunity to make sure that all adolescents living with HIV get support and services that take into account their preferences and needs. In order for differentiated service delivery to be successful for adolescents, investments in community and peer support interventions are required, and strong links between the facility and community need to be prioritized. Stay tuned to meet other adolescent cases.